question?
I'll start now.
Okay, so if you've read and understood, considering it procedural skill station, please begin. Right, please tell me, and after you've read the stem, how would you prioritize and order the theater listing given to you?
My first case would be strangulated inguinal hernia of a patient with a COPD and pacemaker. And
Okay,
second case would be diverticular abscess of patient with allergy to penicillin and iodine.
all right.
And the third patient would be MRCS positive patient with atrial fibrillation who has insulin dependent diabetic foot and needs DKA.
Please tell me, why have you decided to keep the list as it is?
Because of first case, strangulation is always an emergency. So emergency cases should be given the topmost priority. And MRSA, any patient with a MRSA should be kept at the last of the list because of possible cross-contamination with other patients.
All right. Okay, first of all, please tell me, how do you determine which cases should be operated immediately or should be placed as urgent? According to which, yes, criteria?
If there is a diabetic patient, the diabetic patient should be given the topmost right.
Please, according to for clinical priority, there is one criteria which is called National Confidential Inquiry into Patient Outcomes and Death, NCEPOD. According to that, please tell me, how would you or where would you categorize this strangulated inguinal hernia should be placed, should be operated immediately or urgently, and why?
Strangulated patient would be immediate.
Okay. Which procedures should be operated immediately?
Any patient who has.
Yes, this is wrong because any procedure like for ruptured aortic aneurysm, ruptured spleen, in which there is a life-threatening situation, those procedures are operated immediately, and strangulated hernia could wait. It's not immediate. Rather, you could say it's urgent. Right. Please tell me, insulin-dependent diabetic patient, you have decided to place it or go it on number 3. Why?
Because this patient is MRCS positive.
Yes. Okay.
Otherwise, if the patient doesn't have MRCS, then I would have given the first priority because any diabetic patient should be given priority in the list.
Yes.
A patient should not be put on prolonged starvation. And patient should be patient should be given food as early as possible.
Okay.
More than one meal should not be skipped for diabetic patients.
Yes. And there should be routine overnight admission. It's not necessary.
Yes.
Which fluids should a diabetic patient be given?
The patient should be given NS without any dextrose.
Normal saline, you are saying.
No
abbreviation. Don't use abbreviations in exams. Okay, please. The first patient has a pacemaker as well. Right. What precautions should you keep in your mind while operating on that patient?
So I should not be using any monopolar cautery. I should be using bipolar cautery as much as possible. But just in case if I'm using monopolar cautery, then I should limit my bursts to short bursts, bursts instead of continuous bursts.
Yes.
And I should be staying away from the side of pacemaker as much as possible. The electrode plate that should be placed oriented away from the side of pacemaker.
And ECG.
And continuous ECG monitoring
should be done.
there should be a CPR facility should be available on in the operating theater.
Please tell me what's the difference between bipolar and monopolar diathermy?
Monopolar diathermy uses an entry site and with a electrode plate that is placed in the different site. And
Yes.
in bipolar diathermy has two prongs where the electric dissipation is limited within the two prongs.
Good.
And
right. Yes, your first patient also has COPD, chronic obstructive pulmonary disease. What complications should you watch out for?
So in this, I'm not sure.
A risk of pulmonary complications, right? And since
yes,
COPD patient will also be taking steroids, so you already know how to what to watch out. All right, moving on. You can revise that later. All right, moving on to the next patient. A diverticular abscess patient is allergic to penicillin and iodine both. How would you manage that patient?
So this patient, I should label the patient as allergic to penicillin before I should check the surgical. I should make sure about the WHO surgical safety checklist.
Okay.
And, so patient should be given on other antibiotic apart from penicillin.
Yes.
And
for
instead
example,
of iodine, for example, I can give
vancomycin and
vancomycin.
cefazolin. Okay. And instead of iodine, what can you use?
Chlorhexidine gluconate.
Yes. All right. Good. Okay. Please tell me, your pacemaker patient or our patient is also, the third patient is also on atrial fibrillation. So, right. Your patients taking anticoagulants, how would you take care of those patients prior to surgery?
So
The last one.
I would check the anticoagulant. So if the patient is on warfarin, then
Yes.
I'll stop the warfarin 5 days prior to the four days prior to the surgery, and
Okay.
then I would start the patient on heparin. So heparin should be continued approximately 12 hours prior to the surgery.
Okay. Low molecular weight heparin.
Low molecular weight heparin.
Yes.
And then during the intraoperative period, patient should be monitored for any signs of bleeding or bleeding diathesis. And after the surgery, after 6 hours after surgery, I'll restart the patient on both heparin and warfarin.
Yes.
And I would continue monitoring the patient with investigations like PTINR.
Yes.
And if the warfarin function is found to be regained, and then I would stop the patient. I would stop heparin for that patient.
Okay. Right. When you're operating on diabetic patient, this last one, what should be the normal blood glucose or target blood glucose level during surgery that you'll keep in your mind?
30 to 10 to 20.
6 to 10 millimole per liter.
6 to 10.
All right. Okay. Oh yeah, bell went. Okay. Thank you.
Thank you.
Okay, for pacemaker, they normally have one passport as well, like one. You have to, before operation, you have to check that as well, if they are carrying it with them or not. Good.
Okay.
Thank you.
Consultation with a cardiologist and
Yes, anesthetic as well.